Heartbreakingly, 2 children in the US died from measles this year, and both were unvaccinated. The disease we thought was eliminated in the US in 2000, now it's back, spreading faster than the flu. On PeasyHealth, find out why, what measles really does to the body, and how we can stop it. In recent years, there's been a worrying trend. Vaccination rates have been declining, and measles is returning worldwide. By April this year, hundreds of measles cases have already been reported in the US, and heartbreakingly, 2 people have died. Even more alarming, 70% of those infected were children, and 97% were unvaccinated. In Europe, the numbers are even more shocking. Over 127,000 measles cases were reported in 2024. That's twice the number from the year before. What's behind this? Measles is on the rise again, likely because fewer people are getting vaccinated and more people are traveling internationally, making it easier for the virus to spread. Let's not forget, before the measles vaccine was introduced in 1963, measles caused the deaths of more than 2 million people every year globally. The vaccine changed that, saving millions of lives. Now that we've seen the numbers, let's talk about what measles really looks like and how we can stay one step ahead. How does measles spread? Measles is an airborne viral infection, meaning it spreads through tiny droplets in the air when someone coughs or sneezes. You don't need to have direct contact with an infected person to catch it. Just being in the same room, or even entering that room up to 2 hours later, can be enough to get infected. It's the most contagious viruses we know. In fact, 90% of people nearby who aren't immune will get infected. To put that into perspective, one person with measles can infect 12 to 18 others. Compare that to the flu, where one person typically infects only 1 to 2 people. This extremely high contagiousness is what makes measles outbreaks so dangerous. What happens in the body? When you get measles after exposure, there's usually an incubation period of 10 to 14 days. During this time, the virus is silently spreading through the body, and there are no symptoms yet. Then things start to change. At first, measles can look a lot like a regular cold. Cough, runny nose, pink eye, tiny white spots inside the mouth, and a very high fever. But behind the scenes, it's doing much more, especially in unvaccinated individuals. The virus enters through the respiratory system and travels to the lymph nodes. There, it begins weakening the immune system, the body's natural defense. Once the immune system is compromised, the virus spreads through the bloodstream, reaching multiple organs. One of the most recognizable signs of measles is the rash, which typically lasts for several days. It starts on the face, spreads to the chest and trunk, and then moves to the arms and legs. But measles doesn't just affect the skin. It can spread to the lungs, leading to viral pneumonia, the most common cause of death. It can also affect the intestines, causing diarrhea, or even reach the brain, leading to encephalitis, a serious complication that can cause long-term disability or death. And because the immune system is so weakened, the body becomes vulnerable to other infections, like ear infections or bacterial pneumonia. Measles leads to serious complications in 1 out of every 100 infected children. The mortality rate is 1 to 3 per 1,000 in developed countries, and even higher in developing countries. Measles can also lead to long-term complications, even years later, like a rare brain condition called subacute sclerosing panencephalitis, a progressive brain inflammation that may appear 7 to 10 years after the infection, causing mood changes, seizures, coma, and death. How is it diagnosed? Measles is usually diagnosed based on clinical symptoms, but a blood test can confirm the infection. Is there a treatment? Unfortunately, there's no specific antiviral treatment for measles. There is only supportive care available to manage the symptoms: fever-reducing medications, immunoglobulin, and vitamin A supplements. Can it be prevented? Absolutely. And the best way to protect against measles is through vaccination. The measles vaccine is incredibly effective, with a 97% efficacy. The vaccine is given in 2 doses, the first one at 1 year old and the second one between 4 and 6 years old. Some parents believe it's more natural to catch measles than to get vaccinated, but that's simply not true. The vaccine contains a live attenuated virus, a weakened version that safely activates the immune system without causing illness. Many parents who hesitate to vaccinate are motivated by a desire to protect their child's health. But the reality is, choosing not to vaccinate can put their child and others around them at serious risk. Let's also clear up a common myth. Does the measles vaccine cause autism? No. That claim has been thoroughly debunked by extensive research. The original study that sparked the myth was retracted due to serious ethical violations and data manipulation. Now, like any medical intervention, the vaccine can have side effects, but they are typically mild. The most common include a low-grade fever, a temporary rash, or mild swelling of the glands. More serious side effects are extremely rare, affecting about 1 in a million people, and the benefits of vaccination far outweigh these risks. Measles is a serious disease, but it's also highly preventable. Over the past 50 years, measles vaccination has saved an estimated 94 million lives, 92 million of them children. Some individuals can't get vaccinated due to immune conditions, severe allergies, or being a baby, and they rely on the rest of us to create herd immunity and keep them safe. Getting vaccinated doesn't just protect you, it protects your community. If this helped you understand measles even 1% better, hit like. It helps us spread awareness. And share this with someone who may be in danger. This video is for entertainment purposes only. It is not a substitute for professional medical advice. Please consult your healthcare provider for personalized care. Thanks for watching, and I'll see you in the next one.